Since the middle of August 2021, Grenada started recording a steady increase in local COVID cases, first weekly, then daily. The cumulative number of cases reached 5,140. The death toll has also climbed, reaching 149 to date. The government, through its Ministry of Health, is reporting what it calls some positive news. Dr. Taisha Donald, Acting Medical Director, gave reasons for the decline.
Note, and happy to say, over the last week we've seen a steady decrease in the number of positive cases that we have on island. There are different reasons for the decline. One, that the disease is taking its course. Two, that there's an increased amount of persons vaccinated within our population, and that also helps in terms of curbing that spread. And generally speaking, you have the natural course of the disease. So you have that graph where you have a spike and then you have a decline. So we're now in the decline phase where the disease in terms of spread has taken its course, and we're going to now have a decline. Of course, that is also dependent on us following those 4 measures that Dr. Noah spoke about.
The Acting Medical Director also celebrated the increase in vaccination numbers. She noted that people 60 and over with underlying conditions are the ones most impacted by the virus, although the virus has claimed the lives of persons from as young as 18 and old as in their 90s. Dr. Donald highlighted some of the measures and adjustments made for COVID-positive patients that they believe will avoid direct contact with non-COVID patients. A special X-ray area is one such adjustment created to accommodate COVID patients only.
At Accident and Emergency, you would have noted that we established a flu clinic, an area where all persons with COVID-like symptoms or flu-like symptoms can be attended to, outside of the regular triage area. You would also note that our wards have expanded. Our isolation unit has expanded, and we now have capacity at the General Hospital for up to. We also have expanded to establish a critical care unit with 4 beds for ventilation, solely for COVID-19 patients, and it's outside of our ICU for our regular non-COVID patients.
The medical practitioner continued to highlight other adjustments within the health sector.
At our lab, we had to set up a whole new department, our molecular diagnostics department, which is the department responsible for conducting the PCR test. And again, we are very happy to say that it's been flowing very well, functioning very well. Of course, our lab technicians, they've been working some crazy hours. For our patients and their families, we have established a COVID-19 patient liaison group. This is to assist and ensure that family members can be updated and can connect with us and get an update on the status of their patients.
Christina John, GBN News.